Most people undergoing cataract surgery will have their procedure carried out on a day case basis. That means that the patient will enter the hospital in the morning, have their operation during the day and leave on the same day to go home. The operation normally takes about 20 to 30 minutes, and in most patients it's carried out under a local anaesthetic with or without some sedative to relax the patient. In the operating theatre, the patient will find themselves having to lie on a couch or operating table such as this. Their eye would be cleaned and a drape or cover will be placed over the eyes. The surgeon will bring the operating microscope over the patient's eye. And at this point, the surgeon will ask the patient to look directly upwards at the light which we can see here coming out from the microscope. It's important for the patient to keep very still throughout the procedure. During the operation, the surgeon is going to make several small cuts in the surface of the clear window at the front of the eye using instruments like the ones you see here. The largest cut that we make in the eye is around 3 millimeters, so it's very tiny, and it will seal itself at the end of the operation. During the procedure, the patient may well hear certain noises, particularly a buzzing noise, which comes from the machine we use to break the cataract into tiny pieces, which can be sucked out through the very small holes that we've made. The patient may feel water running in their eye or running on their face, as we need to continually fill the eye with fluid to prevent it from collapsing during the procedure. The surgeon will then implant a plastic lens, so-called intraocular lens. These lenses are very small, around 6 millimeters wide, and are in fact folded to go through the incision, which is only 3 millimeters wide, that the surgeon has made in the patient's eye. I have a lens of this sort here, and this is fairly standard intraocular lens of the folding type, and this particular one is coloured slightly yellow to take out any sunlight that might damage the eye. I have a much larger model of the same lens here to show you what this looks like, because it's very hard to see the real lens. At the end of the operation, it's not normally necessary to suture the wounds that have been made, and most patients will not require any stitches. The eye will be protected with a cover, usually a clear plastic shield, to protect the eye from injury. If the patient has not had a sedative, they're likely to go back to their ward or daycare room almost immediately. Patients who have had a sedative will often go to the recovery area and theatre for a short time to recover from the sedative. I would always review all my patients, usually an hour or two after the operation, to ensure everything is satisfactory before they leave to go home. Following surgery, most patients will see quite well within 24 or 48 hours of the operation. For the first few days, they will have to wear the clear plastic shield over their eye at night time, but not during the day. And they will also have to put drops in their eyes, usually around 4 times each day. If a patient has cataracts in both eyes, we would normally carry out the first operation and check the patient 2 to 3 weeks later before carrying out the second operation, perhaps a month after the first. I advise my patients not to swim or to carry out active sports such as tennis for a week or 2 following the operation. Most other activities, such as reading, watching television, and probably driving, will be possible within a few days. I usually review my patients at 2 to 3 weeks following surgery, at which time they're usually seeing very well. They will, however, in most cases, not need glasses for the distance, but they will need glasses still to read. I find cataract surgery a very rewarding operation to carry out because most of my patients experience a very significant improvement in vision following surgery.